Today I thought I would give the nuts and bolts of bioidentical hormone replacement. So as always, I like to define what the topic is. And bioidentical hormones are those chemical compounds that are molecular or chemically identical to those that we already make inherently in our bodies. So they are exact replicas of what we make. Now, synthetic or manufactured hormones are those that may try to mimic the body's hormones, but they are not chemically identical. The synthetic sources of hormones that we currently have on the market may come from horses' urine or some derived plant sources, but then they are chemically rendered down to be chemically related but not identical to the hormones that we make. But the bioidentical sources come from the soy family and wild yams. Now, testosterone powders are mostly derived from phytosterols, which are plant-based compounds. So there are several other hormones that can be replaced and used, but for today's discussion, we're going to stick with the main ones for sake of basically understanding the topic. So I'll just say initially some things to consider is that it is rare for a pill combination to be bioidentical. And that's mostly because when a pill gets into the stomach acid and gets broken down or gets absorbed to go through the first pass effect on the liver, it is not the same compound and it will not get into the system as the hormone that we are trying to correct or replace. Although there are some compounding pharmacies that are starting to get some good results with oral capsules that can make it through those metabolic changes. Now, as a sidebar, the first pass effect is when the medication will circulate to the liver and it breaks down and it may render it low or no concentration of the same hormone. So we're talking a lot about cream-based formulations. So they will bypass the whole liver breakdown and get right into the system through the skin, since hormones are fat soluble. And of course, there's a nice fatty layer just underneath the skin. So as a reminder, we're talking about replacement. So we're not really talking about women in the reproductive years. However, I will say that fertility patients are getting bioidentical hormones because the synthetics will usually shut down hormone production or are harmful in pregnancy. So the estrogens come in many forms, and as I said previously, some of them will come from horses' urine, and that is not identical to our estrogens. Some will come from plant sterols. Some will be chemically similar, such as those that are in birth control pills and pharmaceutical preparations. And then, of course, there are the bioidentical extracted estrogens that come from the soy family. And then we have the progesterone, and we must learn the difference between a progestin versus a progesterone. So progestins are synthetic, and they are similar compounds that try to mimic the body's natural progesterone, but they are not the same. These are the potentially harmful components in birth control pills if you are a cigarette smoker, and these would not be used in fertility to support any progesterone deficiency. These are also in the Depo-Provera shot, Mirena IUDs, and so on. So they come in different ways of delivery. In bioidentical hormone replacement, we are talking about identical progesterone that our bodies made, and it just so happens to be extracted from the wild yam family. What are the signs of estrogen loss? So we may have painful intercourse, vaginal dryness, diminished libido, increased UTIs, irregular periods or none at all, mood swings, hot flashes, headaches, migraines, bone weakness, depression, fatigue, and poor sleep, and memory loss, which is a key issue of what drives some women to seeing me for hormone replacement. So that was estrogen loss. What are signs of progesterone loss? Well, some of them wind up being similar to estrogen when they are off balance. So in addition to that, you could have thyroid irregularities, skin troubles, insomnia, and foggy thinking. So it would go to prove or go to stand to reason that some uses of bioidentical hormone replacement would be to treat things such as hot flashes, night sweats, irregular periods, mood swings, the vaginal dryness, burning, itching, brain health, which is important, brain health and memory, bony health, which would be to help prevent osteoporosis, improving blood lipid profiles, maintaining bladder health, and to actually promote wellness to the urinary tract. So when we're treating estrogen and progesterone, there is a concept called estrogen dominance. And these are a lot of the symptoms that bring women in to be treated. So estrogen dominance is simply stated as when the estrogen ratio is greater than the progesterone ratio, or you could say that the estrogen to progesterone ratio is off, such that estrogen is higher than progesterone. And I would like to remind everybody that all of our cells have estrogen and progesterone receptors, so we do indeed need the balance of the two to optimize our health and to prevent the estrogen dominance. So in our 40s, estrogen dominance may include very heavy menses because the progesterone loss comes from the fact that the ovary, which has the leftover corpus luteum after ovulation, is very poor in producing amounts of estrogen. Very poor in producing the amounts of progesterone during our cycle. So estrogen dominance may hide itself out in other ways that you may not realize that it is hormonally driven, such as it may actually stimulate breast cysts. It will increase our body fat storage, and to that note, it will increase salt and fluid retention. It can promote depression with headaches. It may interfere with our thyroid hormone. It may increase blood clotting and risk of stroke. And don't forget, that's not estrogen by itself being a problem, but estrogen dominance being a problem. It may decrease libido. It may impair blood sugar control. It may cause loss of zinc and retention of copper. It can reduce oxygen levels in all cells. It can increase the risk of endometrial cancer, and this is important when we are talking about estrogen dominance, or in other words, not having enough progesterone. And to a small degree, it can increase your risk of breast cancer, and it may promote a decrease bone loss. So, progesterone's effect then, in an effort to prevent estrogen dominance, would protect us against those breast cysts. It would help use the fat for energy and keep it off of our hips and abdominal area. It behaves as a natural diuretic or a natural water pill. It can actually be a natural antidepressant, and certainly it has a lot of calming effects, and it can facilitate thyroid hormone action. It will normalize the blood clotting. It can increase the libido. It can normalize zinc and copper levels. It can restore the proper cell oxygen content. It can prevent endometrial cancer. It can help prevent breast cancer, and it can increase bone building capabilities. So that was estrogen and progesterone. Now, there are other hormones that can be replaced, such as DHEA, oxytocin, pregnenolone, and several other adrenal factors, or melatonin that is secreted from the pineal gland, which we will discuss at a later date. We also have testosterone compound. And of course, when that is low in a man, we will call it andropause or hypogonadism. And yes, of course, us women secrete a little testosterone from the adrenal glands. We may convert at the fatty cell layer and have a small degree of testosterone ourselves. And yes, it can be replaced too. So who will get bioidentical hormones in my practice? Well, obviously, those who are interested and well-informed. We may also use some supplementation in the form of supplements themselves to help ensure that we don't have some estrogen conversions to harmful estrogens. So that is a comprehensive look at the estrogen and progesterone cream. So we may actually have to complement or augment the metabolism. And of course, we can talk about that at a later date, but I wanted to give the nuts and bolts today. So I will also prescribe to those that are simply just out of balance and exhibiting signs, as we mentioned, and we may need to basically improve the quality of life, because many of us will now start living in menopause and hormone deficiency at least 30 to 35 years. I will also prescribe to those who have simply energy loss and whose symphony of hormones are out of balance, making it difficult to work out, sleep, control stress, or balance the chakra centers and energy fields. I do see a lot of patients who want to target their family history. So I will see some women who have a family history of Alzheimer's. And we have a saying in integrative medicine that E equals memory. So we're basically saying estrogen equals memory. So when that is declining, many women will start finding out their word retrieval, their speed of retrieval, brain fogginess, and things that are affecting their brain health seem to be impacting first. And then there are the family history of osteoporosis and those that have profound bone loss that want to actually optimize their estrogen, and estrogen helps the vitamin D and calcium as a carrier get into the osteoclast and osteoblast to help build our bone. So I will aggressively manage women who want to replenish their losses and make sure there is a mammogram or thermogram. I will make sure that the pap smears that are recommended are normal. Although I will say cervical cancer is not typically a hormonally based cancer, but it is much more of a factor of HPV infections. Again, a topic for a later day. And I will also assess their bone density, and that is in addition to their symphony of adrenal and thyroid hormones, and create a comprehensive picture. So I will obviously test for hormones, and there are several debates over which way is the best way to assess that. So the two main ones are serum, which is blood work, or saliva. And I often tell patients the ideal way to manage and measure would be as if we could get down right into every one of our cells microscopically and watch the estrogen and progesterone get into the channels and into the effect of the cell. But with today's testing strategy so far, that's not possible, so we try to get a ballpark. We, again, are looking at a ballpark picture, but first and foremost, we are treating the patient. We are treating the patient first and foremost. That being said, we don't necessarily need to continually be trying to manage and measure hormones that are just circulating into the bloodstream or getting extracted into the saliva. So, again, the average hormone replacement bioidentical topical cream formulation is very easy to apply. It's as simple as, after you step out of the shower, removing your normal body oils, you are taking a small dollop of cream over a fleshy area that doesn't have much hair, and you're trying to create the widest surface area to promote the best absorption. This would also apply for men who are receiving testosterone gel or testosterone cream, and there are other mechanisms of delivery for men, such as injectables, which is something, again, we could talk at a later date. But the cream formulations are wonderful tactics to take in the bioidentical hormone cream. So quickly, I'd like to just talk about the safety issue. There are a lot of scare tactics in there, but thus far there are no studies to prove that bioidentical hormone replacement causes breast cancer. Again, this is a scare tactic. This is the most safe methodology to go about replenishing your hormones. And again, they're not for everybody, but for those who are low risk, well-informed, targeting symptoms, and going after their genetic destiny to prevent some problems down the road. The FDA has indeed approved all of the powders that are used. So they have approved the testosterone powders. They have approved the progesterone and the estrogen powders. But once they become individualized for each patient, of course, each individualized cream formulation has not gone through a trial. And therefore, there is criticism that each formulation has not been FDA approved. But the compounding pharmacy concept that individualizes medication for us was the way that most medicines were made in the past and not in the far past. Pharmacists are fully trained, they are overseen, and they are qualified to make these formulations. So I believe that criticism is quite insulting to the profession to go after these compounding pharmacies as not being FDA approved. So in general, to summarize, I would say you should talk to your integrative physician about potentially testing hormones and optimizing your hormone health. Get educated on the topic. Place any questions below that you may have in the comments section below. Subscribe to my channel so we can discuss many future relevant health topics, and I would be more than happy to engage in the topic. take a phase 2, 3, or 4 discussion in the future about bioidentical hormone replacement therapy. I hope this has clarified some understanding and help you navigate your understanding of this topic. And as always, until we meet again, be well.